Hello, I am MBlasing, and I am doing my PowerPoint on multiple sclerosis, otherwise known as MS. Some facts about MS. MS affects 500,000 people in the United States. Women are diagnosed twice as often as men. No two people have the exact same symptoms. And some other things to keep in mind is according to the National MS Society, MS is an unknown cause. Scientists believe the disease is triggered by unidentified environmental factors in a person who is genetically predisposed to respond. Some other factors that have been found in research have been age, gender, and ethnic background. Symptoms can fluctuate or change over time. What is MS? It is an unpredictable disease that disrupts the flow of information within the brain and body to the central nervous system. It attacks the neuron sleeve, which damages the cells that surround and protect the spine and brain, causing nerves to be exposed with no protection. MS and the effects of the body. Because the nerves are exposed and have no protection, it puts your body at risk for your chest muscles, which make it harder to breathe. It could weaken your throat muscles, which make swallowing difficult, which also puts you at risk for inhaling food and drinks into your lungs. It can cause speech problems, such as poor articulation and volume control. Research has shown 4 out of 10 people are affected by this. It causes problems to the arms and legs, such as numbness or pain, and you may end up having to be assisted with a walker, a cane, or even a wheelchair. Nerve damage can also cause bladder problems. Some treatments: plasma exchange, therapy such as physical therapy, speech therapy, and also respiratory therapy. Physical therapy will help you with your arms and legs, trying to strengthen muscles for those. Speech, they're going to work with your fine motor skills. And then respiratory therapy can also help you with breathing techniques so it's not as painful. Some medications are corticosteroids, the dexamethasone and the methylprednisolone. They are given to you an IV, and they help the ease of the inflammation, which reduces flare-ups and attacks. And then the prednisone is orally. Some other medications are out there to help with muscle spasms and stiffness. Some signs and symptoms to watch for: numbness and weakness to the limbs, slurred speech, partial or complete vision, problems with bowel and bladder, and because some of the problems that you have, you could end up having catheter, which will help with the bladder spasm, as well as with your bowels. You could have constant diarrhea, constipation, or total loss of bowel control. Diminished brain function, paralysis, dizziness, depression. There are some short-term and long-term consequences. Short-term including fatigue, nausea, and dizziness, which can all be helped with getting enough rest, medications. And long-term, paralysis, diminished brain function, loss of vision, speech or swallowing problems. And the long-term effects are a little more severe than the short-term. Suggested lifestyle changes: make sure you get plenty of rest. If you exercise regularly, that will help with your muscle strength. Keep your body temperature cool. That could help with the inflammation. Have a healthy, balanced diet. Living with MS. Remember, you can control multiple sclerosis. It doesn't have to control your life completely. And if you listen to your doctors and use the resources available, you will be able to have somewhat of a normal life without pain. Thank you.